So I'm Jess Mandel. I'm professor of medicine at University of California, San Diego, and also serve as associate dean there. So this is the 6th edition of Principles of Pulmonary Medicine, and the book has always been focused primarily on medical students, residents, fellows, and a lot of material in there for practicing physicians as well. But really, we've always strived to make it something that is readable from cover to cover and provides value. A lot of times, trainees and physicians need to read in great depth about specific patients, as we all do. This book provides some of that deep information, but also allows someone to really go from cover to cover and emerge with a broad understanding of some of the main issues in pulmonary medicine. Well, it's an area of readers that are sometimes neglected in terms of the books that come out. There are a lot of very thick, very weighty, 30-pound texts in pulmonary medicine, which are fantastic and can be a great resource, but it's very unlikely that you'll actually be able to comprehensively read from one cover to the other in those. And I think there's really a need to build a foundation of knowledge for medical students, residents, fellows, etc., as they move forward and build that knowledge in pulmonary medicine. One of the things that has made Steve Weinberger and Barbara Cockrell very recognized educators is that they're very good at putting themselves in the eyes of the learners, and I've tried to do that as well as we've written this volume. And we really try to scrutinize each chapter very closely and make sure it's well written, that it's written at the appropriate level, and that it really answers the basic questions that we expect our readers to have. I think we've made a number of improvements for this edition that we're very excited about in terms of some of the web enhancements, some of the audio introductions to each chapter as well. We've expanded the number of self-assessment questions. So we think all of that packaged together with the core text is a very engaging package for people to explore. One of the important things in dealing with some of the pulmonary illnesses that are potentially life-threatening and potentially very serious, one of the challenges is really being able to balance communication of prognostic information to the patient with allowing room for appropriate hope for patients. We deal with very serious diseases in terms of emphysema, lung cancer, pulmonary hypertension, just to name a few. And in all of those areas, I think there's significantly more room for hope now than there was 10 years ago, 20 years ago. And we want that to get across, that these are important diagnoses to make because patients have options. Patients and the people who treat them really have important decisions to make around those conditions. It's extremely rewarding to feel that you're potentially making a contribution to the training of future physicians, not only those in the room in front of you in your own medical school and your own hospital, but potentially across the country and in other countries as well. One of the biologic sort of hard walls that we deal with in pulmonary medicine is that lung function really maximizes in young adulthood, and there's a slow decline after that time, and this decline can be accelerated by emphysema or other conditions that our patients encounter. But overall there is this decline, and I think one of the next key frontiers is really in what's called regenerative medicine, to try to translate some of the test tube advances in stem cell medicine to actual patients and try to be able to push back against this really fixed limit of pulmonary function that declines with age.